now, working hard on no on 69. So we're going to have plenty of time for you to ask questions. So I'll let Freddie come on up and lead the way. Thanks, Freddie.
All right, if you can't hear me, just let me know. I'm notoriously bad with microphones. Well, thank you for the opportunity to be here. Again, my name is Freddie. I'm part of a broad and diverse coalition who are opposed to Amendment 69. So after years of debate and division, healthcare remains a really critical issue in our state and our nation. Too many people can't gain access or afford the healthcare that they need. This is a real issue that impacts real lives right here in Colorado. But regardless of where you live in Colorado, Front Range, Colorado Springs, even the Western Slope, even regardless of whether you philosophically support a single-payer healthcare system at the federal level, I think Coloradans can agree that Amendment 69 is not the right answer for Colorado, and I'm here to let you know why. So this is a really complex proposal with a lot of facets and many unknowns. We're going to cover a lot of content today pretty quickly, but if you walk away with nothing else, if you could take these three words with you, which is risky, uncertain, and unaffordable. So here's what you need to know. It's risky. There are a few things more personal and important than healthcare, and Amendment 69 will scrap our current healthcare system for a first-of-its-kind, untested government healthcare system. And that's a risk we can't really afford to take with our healthcare or our economy, and it will lock that system into our Constitution. It's uncertain. Amendment 69 leaves a lot of important questions about coverage and cost unanswered, and empowers a board of 21 politicians to make critically important decisions about your healthcare for you. And it's unaffordable. Amendment 69 creates a massive new tax burden for all Coloradans, which will have a significant impact on our economy. Typically in an issues campaign, the proponents will want to get down to the details and really dive into the details of their system. It's a little different in this campaign. The proponents will try to sell you on an idea, a concept, something that sounds nice, and convince you that Colorado can figure out the details later. But I'd really like to talk to you about the details of what is in this amendment, or actually more importantly, the lack of details in this amendment, and why it's a bad deal for Colorado. So Amendment 69 will set up a new political subdivision of the state. Another example of a political subdivision is like a school board. Now, they're going to call this system Colorado Care, and it will administer a first-of-its-kind care system that will replace all of the private healthcare insurance currently in Colorado. This new entity is independent of existing government structures. They are not accountable to the governor, nor to the legislature, and they'll actually be the only elected position in the state that is not recallable. It lacks a lot of the typical checks and balances that usually exist in our democratic systems. And unlike other government entities in Colorado, Colorado Care would be exempt from TABOR, which is actually in the language of the amendment. So Amendment 69 will raise $25 billion in new taxes. For context, the current state budget of Colorado is about $27 billion. This new tax revenue comes from two sources. There is a payroll tax, which is shared by employers and employees. Employees will pay 3.3%, and employers will pay the 6.7%. There's also an income tax on virtually all non-payroll income, which includes dividends on savings, investments, even some retirement income. And the only income excluded from the non-payroll income is a modest portion of retirement, alimony, and unemployment. The way I would explain it is, tax code is complicated, and I won't pretend to understand all of it, but Amendment 69 is simple. There are no new exemptions created with Amendment 69, so whatever you pay taxes on at the end of the year now, it'll be 10% on top of that. Now the non-payroll tax is a real hit to seniors and entrepreneurs. Oh good, I didn't do that. So it's a real hit to seniors and entrepreneurs. For seniors, all retirement income, including Social Security and pensions, above about $24,000, again, that depends on your specific exemptions, will be subject to the tax. Any amount above that level, below that level is not subject to it. Above that level is subject to the tax. Meaning seniors will be paying into this system even though their primary source of coverage will remain Medicare. Because Amendment 69 is a Colorado amendment, meaning it can't replace federal systems. So if you're on Medicare or TRICARE, those things still exist, but you will still pay for Colorado Care whether or not you're using it. For entrepreneurs, family businesses, farms, and any other businesses that are structured as a pass-through entity like LLCs, LLPs, S-corps, things like that, they're hit hard by Amendment 69 because they'll see the full 10% tax on all their business profits, and that's whether or not those profits are realized to the individual at the end of the year or not. In 2015, Colorado had 52,032 corporate filers and 235,733 pass-through filers. So this really will impact virtually all Coloradans, working families, entrepreneurs, members of the military, even seniors. They will be paying whether or not Colorado Care is their primary source of coverage. And if Amendment 69 passes, actually, Colorado will have the highest income tax rate in the country. Now, this new tax revenue alone does not make up all of Colorado Care. Pending approval for a federal waiver, Colorado Care takes over the state's federal medical money that comes into the state for Medicaid and other programs, which is estimated at about $11 billion. So all in all, Colorado Care is a $36 billion entity. I believe that probably says 38. It's actually 36. The Colorado Health Institute released a new study last week or the week before that estimated about 36 billion. But again, for context, that is still larger than all those companies. It's larger than Nike, it's larger than McDonald's. This is all controlled by just those 21 people I talked about. So 21 people will be controlling a budget larger than the state budget. The state's budget is voted on by 101 elected officials, that's the legislature and the governor, and is subject to hundreds of hours of public hearings. But these 21 people will be empowered to make critically important decisions about your health care and the specific benefits that you receive, like which doctors and hospitals you can use for specialty care, and how much those doctors and hospitals are paid. The only eligibility criteria to be on this board is that the person is at least 18 years of older and they live in the district that they seek to represent. There's no requirement of knowledge of healthcare or background and experience in healthcare. And as we've quickly seen play out right here in Colorado, even small elections can very quickly become politicized. A school board is another good example of that. So this would be concentrating a lot of power into a really small hands of politicians. And again, these are the only elected positions in Colorado that you cannot recall. However, with a simple majority, they can vote each other off of that board. This new system will be locked into the state's constitution. It's exceedingly difficult to make changes to a constitution once the amendment is in place. Anyone who's lived in Colorado for more than really a minute has probably heard about the challenges we have in public policies that have been put into our state's constitution, things like Tabor, the Gallagher Amendment, Amendment 23. Whether or not you support these amendments, most people can agree that it's wreaked a lot of havoc on our state's budgeting and governance process, and Amendment 69 would just further complicate that mess. Amendment 69, again, does work around Tabor. So Colorado Care would be a first of its kind entity. There's no state level system that we can truly compare it to. Anyone who's launched a company or undertaken a complex project, or even like a not so complex project, like a home renovation, probably knows that when you begin, you try to estimate costs, but rarely, if ever, do you come in at or under budget. And with something as large as Colorado Care, with so many variables, even if they're off by just a little bit, the consequences can be very, very large. So what happens if the $36 billion is not enough? Because it's locked into our Constitution, we'd have very few options at that point. We can cut benefits, we can cut the payments to healthcare providers, or they can raise taxes again. If to raise taxes, the board has to ask the members of the plan. By the way, the members of the plan are not necessarily Colorado voters. They have a different definition for that, so they'll have their own election system. But they will have to ask the members once a year for a tax raise. A tax increase, but at that point they're asking, would you like to increase taxes or would you like health care? At this point it's not much of a vote, we need health care. The proponents will compare this a lot to Medicare. Medicare has grown from 0.01% of our GDP in 1966 to over 3% in 2015. If this sees even close to that amount of growth, the consequences and the costs that will grow will be incredibly large. And also Medicare benefits have proven to be insufficient, which is why we've seen the rise of private supplemental healthcare programs. Now these systems may or may not exist once there's a smaller pool of people paying into them. And then the $25 billion will just be a starting point or a floor of costs and benefits offered, which would be a basic package and will have to be raised later on to keep up with the growth. So, as for coverage, Amendment 69 outlines 11 broad categories of coverage, things like outpatient care, hospitalization, end-of-life care, but there's absolutely no detail about specific benefits within this amendment. That will be left to the board to decide what is actually covered and what is not covered. This is tremendously concerning for anyone who has a serious chronic illness because they have no way of knowing if their experimental treatments will be covered by this plan or not. And coverage is closely connected to my next point, which is access. Healthcare providers, nurses, family doctors, specialists may or may not be willing to work in a system where their pay is determined by the government. We're already facing healthcare shortages in much of the state, and there's no way to know if these people will be willing to accept that or move out to outside markets where their pay is not determined by the government. Which kind of brings us into quality. Healthcare systems may not be able to continue to invest in centers of excellence or provide any innovative life-saving treatments for a lot of vulnerable Coloradans, especially if our specialists decide that it's not in their best interest to stay here, again, when the government is dictating their pay. So currently, Colorado's economy is on a roll. National and local experts agree that Colorado is a great place to do business and earn a living, but Amendment 69 really puts that all in jeopardy. Small business is the backbone of Colorado's economy, and entrepreneurs and other pass-through entities will all be hit hard by the full 10% of this income tax. And that's, again, whether or not those profits of a small business are realized at the end of the year, they still tax 10%. Anyone who has a smaller profit margin will not be able to continue doing business in the state, as well as businesses who have operations within and outside of Colorado. They will pay the tax on all of their in-state, of all of the employees they have in Colorado, meaning if it's cheaper for them to move somewhere, New Mexico, Texas, anywhere around us, there's nothing to incentivize them to stay. Now, our current healthcare system is challenged, but Colorado's made real and meaningful progress in building a better system over the last 10 years. We've reduced the number of uninsured people in our state. We're working on ways to improve healthcare outcomes, and Governor Hickenlooper understands this, and that it's a real threat to our healthcare, which is one of the reasons that he opposes Amendment 69. I did mention that we are a bipartisan coalition. We have Republicans and Democrats working together because no one believes that Amendment 69 is the right answer for Colorado. Now, we are the first of the state to we would be the first state to entertain a constitutional amendment to create a state-level government plan, but we're not the first state to explore the possibility. Vermont thoroughly vetted this concept. Their governor actually ran on a program for a single state government system, and actually decided at the end that they couldn't afford it. The legislature had passed it, and legally or illegally, he decided to stop it because it would have bankrupted their state. So we should be willing to accept those risks here in the state of Colorado. The other thing is that you'll hear this compared a lot to like European countries or Canada. The difference is that we are a state, we're not a country.
Can you shout?
Yeah.